So, my presentation is about gonorrhea or Neisseria gonorrhoeae. The introduction to gonorrhea. Description is that it is a gram-negative capnophilic diplococcus that appears as a kidney bean shape under a microscope, as you could see in the picture. The causative agent and reservoir. The causative agent is Neisseria gonorrhoeae, and the reservoir are humans. The main reservoir for the continued spread of gonorrhea are asymptomatic patients. So, up to 50% of infected women and 10% of infected men are asymptomatic, but they could still be infectious for months. The transmission of gonorrhea. Gonorrhea is transmitted through sexual contact, such as genital-genital, oral-genital, or rectal-genital. The bacteria can survive for a short amount of time outside of the human body, but transmission outside of the body is very rare. Gonorrhea can also be transmitted from a mother to her newborn during childbirth, if the newborn comes into contact with the mother's infected birth canal, and this is called gonococcal conjunctivitis. To infect, the gonococcus must attach to the mucosal cells of the epithelial wall, and then after that, the pathogen invades the spaces separating the columnar epithelial cells, and then with this, the invasion sets up inflammation. The history of gonorrhea. Gonorrhea is an ancient disease which was described and given its present name by the Greek physician Galen in 150 CE. So, gon means semen and rhea means flow. Incidence in the U.S. Incidence in the U.S. has increased from a low of 98.1 cases per 100,000 people in 2009 to 206.5 cases per 100,000 people in 2020. So, this explains the picture on the right. But more recently, in 2023, the U.S. reported 601,319 cases of gonorrhea, making it the second most common nationally notifiable STI. However, the rate of gonorrhea in the U.S. has been declining since 2021, with a 9.2% decrease from 2021 to 2022 and a 7.7% decrease from 2022 to 2023. Incidence worldwide. According to the World Health Organization, also known as WHO, the global incidence of gonorrhea in 2020 was an estimated 82.4 million new cases among people who were 15 to 49 years old, and the incident rate was 19 per 1,000 women and 23 per 1,000 men. So the majority of cases were in the African region and the Western Pacific region. However, it is difficult to determine the exact global amount of gonorrhea because of the lack of diagnostic and reporting systems in many parts of the world. Symptoms. Symptoms and signs. According to the CDC, gonorrhea often has no symptoms, but it can cause serious health problems even without symptoms. So, in most women with gonorrhea, as I mentioned, they don't have symptoms. But even when a woman has symptoms, they are often milked and can be mistaken for a bladder or vaginal infection. But if a woman does have symptoms, the symptoms may include painful or burning sensation when peeing, increased vaginal discharge, vaginal bleeding between periods, and symptoms in men can include a burning sensation when peeing. The signs in men can include visible yellow, white, or green discharge from the penis, redness or swelling at the opening of the urethra, or tender or swollen testicles. And the signs in women can include cervical inflammation or redness during a pelvic exam. Discharge is visible in the vaginal canal or in the cervix, and there is swelling or tenderness in the pelvic area. Diagnostic test. Nucleic acid amplification test, also known as NATs, are the most common diagnostic tests for gonorrhea. NATs are sensitive and can detect small amounts of DNA or RNA from the Neisseria gonorrhoeae bacterium. Differential diagnosis is that gonorrhea is most commonly confused with chlamydia, since they are both STIs with similar symptoms like burning during urination and abnormal genital discharge. However, they are caused by different bacteria and may require slightly different treatment plans. So, the only definitive way to diagnose gonorrhea is through a laboratory test, which typically involves a urine sample or a swab from the genitals. Treatments. So, treatments typically involve one injection of ceftriaxone, um, and the dosage just depends on your weight. But if you're allergic to ceftriaxone, the healthcare provider may inject gentamicin plus azithromycin, which is an antibiotic you take orally. The healthcare provider may prescribe additional medication like doxycycline to clear the co-infection with chlamydia. The time and the side effects. So, gonorrhea clears up within 7 to 14 days after treatment with antibiotics. Um, Gonorrhea is curable now, but it's becoming more resistant to antibiotics. So, some forms of gonorrhea that have developed a high level of antibiotic resistance are commonly referred to as supergonorrhea. The new development slash future medical research. So, as mentioned previously, um, gonorrhea is becoming resistant to antibiotics. So, during 2017 to 2022, the prevalence of antibiotic resistant strains in Neisseria gonorrhea increased in China. So, with the resistance to ceftriaxone, which is the first line of treatment for gonorrhea, um, is approximately tripling. So the resistance varied by geographic. So the resistance is varied by geographic region, and gonorrhea strains were resistant to other antibiotics at prevalences up to 97.6%, varying by antibiotic type. The effective diagnosis and treatment are essential to protect the health of infected people and prevent ongoing transmission of antibiotic resistant gonorrhea. So finding the causes of the rise of ceftriaxone resistant Neisseria gonorrhoeae in China could help direct the use of antibiotics and other initiatives aimed at preventing the spread of resistant strains. So, two ways could be strengthening surveillance. So, you could improve the surveillance of gonococcal resistance to antibiotics, especially in regions with high resistant rates. And the other way is update treatment guidelines. So, we regularly update treatment guidelines based on the new evidence we find. Thank you.